Jessica Stone reporting there. Well, for deeper analysis of the CBO score on the Obamacare repeal bill, I'm joined by Wendell Potter. He's a former health insurance industry executive and author of Obamacare, What's in It for Me? Welcome to the show.
Thank you.
Now, let's start with your reaction to this latest version of the healthcare bill.
You know, it's not very much better than the previous version. It still would mean that at least 23 million people would lose their insurance very quickly. And within a few years, we would be right back to having 50 million Americans who do not have any insurance. And that's 1 out of every 6 Americans. So it's going very much in the wrong direction. And it would not save cost. It would save the government some money because the government would not be helping people to afford the care that they need. But it would be pretty devastating for a lot of American families.
So what do you think will be perhaps the biggest hurdles for this bill?
I think the biggest hurdle is the fact that a lot of the members of the Senate, in particular, probably will hesitate to pass something that will be this draconian, that would affect their constituents so adversely. And many of the senators, I think, are more aware of that and have a better understanding of health policy than a lot of members of the House of Representatives. So I think that members of the Senate, in particular some of the moderate Republicans, just will not go along with this. So I think one likely scenario is that maybe nothing actually gets enacted that would repeal the Affordable Care Act.
Now, let's look at spending. How does the U.S. healthcare spending compare to, say, other developed nations?
The U.S. spends far, far more on healthcare than any other developed country in the world. It spends a lot more per capita as well as overall, and our outcomes are not nearly as good as most other developed countries. And there are several reasons for that. One is that U.S. policymakers continue to believe that the so-called free market can work in healthcare as it does in other sectors of the economy. That's not the case at all. In fact, it often works in the opposite direction. It can fuel inflation and frankly, lead to more people not having coverage.
Now, we have seen a lot of movement from pharmaceutical firms. In fact, 8 pharmaceutical firms spent nearly $4.5 billion, basically doubling their lobbying spending in the first few months of this year. And of course, we also saw a recent protest against the administration's position on science. So what is the state of the relationship between the Trump administration and Big Pharma?
Yeah, I think it's actually a pretty close relationship. The pharmaceutical industry spends a lot of money every year on lobbying, certainly in any year in which there is likely to be some legislation or the possibility of legislation being enacted that could affect their profits. They spend more than any other industry. For example, during the debate 9 years ago, 8 and 9 years ago, on the Affordable Care Act that became what's called Obamacare. So they spend money a lot more than any other industry, quite frankly. The thing is that they have a very close relationship with regulators in the Trump administration. So I think they know that they're not likely to suffer any adverse consequences regardless of what happens. And the legislation that has been passed by the House and that is now going to the Senate really doesn't affect their fortunes very much at all.
Now, we did see some friction. We know that in a press conference before his inauguration, Trump said drug makers were, quote, getting away with murder when it came to profits. What's the likelihood that all this will actually result in lower drug prices and more competition?
There's not a chance. Nothing in this legislation would do anything that would bring drug costs down in the United States. There does need to be more competition, but as I said earlier, the drug industry has done an incredibly good job of capturing the U.S. regulatory system. The Federal Drug Administration is very friendly to the pharmaceutical industry. They've got a lot of friends on Capitol Hill in Washington, in Congress, and now the White House. So they've invested wisely in terms of campaign contributions and lobbying expenses to have a lot of friends all over Washington. So that's not good news for American consumers because drug prices are increasing very rapidly in this country. And Americans spend far, far more for medications than any country in the world. We spend, on average, for example, almost exactly twice as much as Europeans do.